Good morning, I'm Dr. Deuk Majan, actually it's afternoon, and I'm Deuk Spine Institute with one of our patients. And this patient is willing to share a little bit of her story, and I think it's important to share for a couple of reasons. Sometimes I get patients that come in for treatment, they think they have pain in their back or neck and they don't know what they need done. And we always try to fix people without surgery with less invasive treatments using usually a needle procedure called interventional pain management. And most of the time we're successful at treating patients' pain to get them back to the level of activity and lifestyle that they want without pain, and they don't need the surgeries that we do here. So that's always our goal, is to do less for the patient but still achieve the goals of pain relief. And sometimes we have patients that get confused because they do the needle procedures and they don't get better, they end up needing surgery. And what we found is about 15% of our patients go on to need surgery that we're treating with interventional pain management. So chances are, if you come to Deuk Spine Institute with pain, there's about an 85% chance you won't get surgery or need surgery because we'll fix you without it. And one of our cases is sitting right here. So you want to tell us what happened?
My experience has been actually very surprising, and it's been wonderful. I came up here with, I think, really acute pain in my lower back. It was widespread from the left to the right side. And it was determined after looking at the x-rays and the MRIs to start off first with the injections. I believe they were steroid injections, to see if that would work. And it was fabulous. It worked for 2 weeks. But at the same time I was informed about the injections, I was also told they don't always work for a long time. If they do not work for you, then we have another process. The next step will be other injections. So I was made aware of that at the same time. Sadly, they only worked a couple of weeks, but I already knew that was a possibility, so it wasn't a surprise. And so I came up and got another set of injections, only on one side, for the nerves. And happily, I have had zero pain since I've had those injections. It's been fabulous. And I know there's not a guarantee with that either, but at this point, everything looks good, not a problem.
So when you came here, did you think there was a possibility of surgery?
It was mentioned as a last resort, but there were going to be previous steps taken.
Right.
To see if that would have to be the end result.
Okay. And the first set of injections you had were the epidurals. The second set were completely different. They were a facet injection, right? A different part of your body.
Correct.
Yeah. So not all injections are the same. Different injections treat different things. And so you're living proof of that, because the epidural didn't work, where we inject medicine in the epidural space where the nerve and the herniated disc are, but yours were in the facet joint, which has arthritis, inflammation, and it worked. Did you have a rhizotomy done where they killed the pain nerve with a needle?
That was the last injections I had.
Okay, so you had the rhizotomy done, and you're doing how?
100% free of pain.
100% free of pain, cured. And you told me something a few minutes ago when we were talking before the video. You said that you've been trying to do the things that normally would bring the pain on. And
a lot. And yesterday was a real test. I did something that normally I could not have done it more than 10 minutes. And I did it for almost an hour and 15 minutes, and I had zero pain.
So basically we cured your back pain without doing surgery.
Correct. Yeah.
Congratulations.
Oh, thank you. Congratulations. Yeah.
Yeah, Deuk Spine Institute. Anything else you want to say to the audience?
I'm thankful, grateful beyond words that I found you, that I found this place. I can't even imagine. I don't have a horror story. I'm one of the people that got their back treated successfully with no horror story. And I've heard some.
Oh yeah.
And it's scary, it's terrifying. So I get to go and tell everybody I know that I had terrible back pain for 6.5 years. There were a lot of things I couldn't do, and it was very frustrating, very depressing, and I get to go back to doing the things that I have missed.
That's excellent, and that's why we do what we do. And at Deuk Spine Institute, we don't have horror stories. what's horrible for me as a treating physician is when I don't get rid of 100% of the pain. If I only get rid of 80 or 90, that's my disappointment there. That's what drives me then to do better, for the patient.
You don't have to do that with me.
God bless you.
Thank you very
Have
much.
a